Brain injuries have been in the spotlight in recent years, and for pretty good reason.
That's right. That's because concussions are on the rise here in the U.S., increasing 43% from 2010 to 2015. Sunrise reporter Roland Rodriguez joins us live from Bay Area Hospital. So, Roland, what symptoms should people be on the lookout for?
Good morning, guys, and good morning, South Texas. Feeling dazed and confused and losing consciousness are some of the signs. It's estimated that 2.5 million people sustain some type of traumatic brain injury every year.
All right, do we have some breath sounds? Can you check for breath sounds?
A traumatic brain injury is caused by a bump, blow, or jolt to the head that disrupts the normal function of the brain.
And the biggest complication is that we want to avoid is long-term injury, and so brain damage essentially is what we want to avoid over. So that's why we've got to be able to diagnose it early and treat it as quickly as possible.
Head trauma is frequently caused by falls, motor vehicle crashes, assaults, sports, or combat injuries. All ages may be at risk, especially children, young adults, and those over age 60.
If the appropriate treatment is not started right away, then you're looking at progressive injury to the brain that can eventually turn into a potential temporary deficit into a permanent one.
Knowing what symptoms to look for can aid you in getting help faster and preventing further harm.
We're looking for anything that will make someone act differently than what their baseline is. Passing out, loss of consciousness, dizziness, even severe headache, nausea, vomiting, sometimes seizures. Specifically in children, again, you want to look at what is different about this child that he normally does that is changed, right? So we're looking at, is he sleepier than usual, or he or she sleepier than usual, or actually more hyperactive, where especially nausea or mostly vomiting is actually a big clue.
Traumatic brain injury is a major cause of death and disability in the United States, contributing to about 30% of all injury deaths.
And what makes a difference is time, is how quickly you get the patient to where they need to be.
Of course, we'll have more information later on our website at krstv.com. Mike.
All right, let's stay with medical news here.